My name is Noni and I am a pharmacy student at Keele University going into my second year, and I was an intern at DataCan. The Black Interns program was a program put together by Health Data Research UK, and it was basically meant to give more exposure to Black scientists and data scientists into the field of health data science, as there's currently a lack of representation in the field. I decided to apply to be one of the interns because currently in my course, we haven't had much exposure to the field of health data science. And I thought it would be a really good opportunity to gain exposure to a field I haven't had any experience in, and possibly see where my future career could be. Whilst I was at DataCan, I was part of the PPIE, Patient and Public Involvement and Engagement department or sector. And basically I got to observe, members of these PPIE groups being, giving their opinions and having involvement in decisions made about health data science at DataCan. And my own personal project that I completed whilst I was with DataCan was I interviewed a few members of these PPIE groups to try and see what can be done to improve PPI groups in general and increase patient and public retention in these groups. I think the thing I learned most whilst working at DataCan was, especially because of the department I was in, was just how important it is to allow patient representatives, patients, and members of the public to have a say in things to do with public health and health-related things, and to make them feel involved. Because at the end of the day, I think trust is what's most important in this health field. And things like PPIE groups can really help, build trust in these areas and allow the field to progress. So it's something that I will hopefully take with me as I continue on my career. I think the biggest highlight for me was when I was interviewing the different members of PPIE groups and getting to really hear about them and their stories and why they chose to be in these groups, what these groups meant to them, because I was able to see things from a completely new perspective and, learn about a completely different industry or sector that I've never been exposed to before. So yeah, that was the most impactful. Well, the program was just launched and it was only 6 weeks. I think maybe to get a more holistic view or, become properly ingrained into the team more, I could have stayed for longer than 6 weeks. But other than that, it was a really enjoyable and experience, and I learned a lot. Yes, I would, especially if you haven't had exposure to this field before. I think the people I was with at DataCan were really supportive and ready to help learn from me and to teach me new things. And so I think don't be too afraid if you're not exposed to this area prior, because they are really helpful. And so I would encourage everyone to apply. Say yes to every opportunity and get involved. It's a great opportunity to, meet new people, learn from them, make connections. So it's important to really take each opportunity as it comes and cherish the time you have there and make sure to get involved. I was really thankful for this opportunity, as, I don't have many role models in the sense of people who I know who have gone into this field of health data science. And so I haven't had much exposure prior. And so I think it is important to keep doing programs like this and giving people who may not have as much exposure or who may not be as inclined to go into certain fields the opportunity to, be exposed to it and learn and possibly spark new interests and people who may end up working there in the future. Obviously, I would hope to graduate from pharmacy school and become a qualified pharmacist and work as a pharmacist, but my main goal is to work in public health.